and it is going on right now as we speak.
Oh, nice.
And so we have coaches working with the kids to help them get their business plans. They're gonna together, and they're gonna be pitching tomorrow.
Yeah, I don't know, my son had helped with. Okay.
Yeah, so we have about 30 kids that are over there on another Zoom doing their thing. All right, Mr. Stephen, where did Stephen go? There you go. We're up when we're ready. Welcome, everyone.
Well,
Roger, I got you covered here today.
You do? Yeah. Go ahead. Yeah, we know what's up. Yeah. Nothing like them Yankees.
Oh, you're recording. Oops.
That's okay. Ready,
all right,
Stephen?
I think everyone join it. Greg.
Good morning, good afternoon, and good evening to some. Welcome to the community briefing. My name is Gregory Sneed, and I am one of the hosts for today's conversation with Dr. Glenna Tolbert. And a little bit about me and who I am. I am a financial professional, been in finance for 40 years, and I help my clients keep more of the money that they make. Some people believe that they can do better in holding on to the money. You're making money, but where does it go? So I help folks become reacquainted with their money through using some software and a program. So I'll put some information in the chat. And if you'd like to meet up with your money, hit me up. Now we'll introduce our queen, Miss Crystal Mitchell.
Thank you guys all for coming. Thank you guys. Thank you, Dr. Tolbert, for being our guest today. I am Crystal Mitchell. I am the co-director of Recycling Black Dollars, as well as an entrepreneur and the founder of Mitchell Business Solutions, where I provide business startup and mentorship for small business owners, as well as I host a podcast called The Business Zone with Crystal and Gilbert. We broadcast every Friday afternoon at 3 p.m. live on Facebook and YouTube, and then the community briefing. And I have another program called Communications on the Patio, where we discuss how you retire. And so that's who I am. I am very committed to our community. I'm unapologetically Black, and my whole purpose on this life is to support Black people, and especially the youth. So welcome all of you. Make sure you put your contact information in the chat room. This is, in addition to being an informative platform, it's also a networking platform. So can't say I'm the co-director of Recycling Black Dollars without asking you to support another Black hand, another Black person that looks like you, that is in business. And so welcome, glad to have you. And so with that, we have Dr. Mays. I was hoping she would come today. And with that, I'm gonna turn it over to my other co-host. We have 4 amazing co-hosts on the community briefing, and I'm turning it over to Ms. Robin Billups.
Good day, everyone. It's Robin Billups with the Billups Group. I am a business advisor, business consultant, community activist, advocate for Black folks' lives. And today, my message today, I always try to come up with some kind of message for the week. There are 2 new books that are coming out. One of them is called Dear White Friend, written by one of my wonderful, wonderful colleagues, Dr. Melvin Gravely. He's out of Ohio. Find this book. Read this book. This individual, I'll put it in the chat box, and he's on LinkedIn as well. Melvin Gravely, Gravely. He's an exceptional individual. He believes in us. He owns his own business. He's in the construction trade now, but he's done quite a few things. I met him many, many years ago when I got involved in supplier diversity, and he's just a straight shooter, truth-telling Black man. And then secondarily, locally, our friend Michael Anderson, he's an architect, and Michael has a book that's coming out. He has a book signing and a book reading and a question and answer session that's coming up in the next, let's see here. It says the book release party, signing, reading, and questioning answer Urban magic, the vibrant Black and Brown communities are possible. It will be hosted at the Hot and Cool Cafe in Leimert Park on August the 10th. Again, I'll put that in the chat box, but again, Michael Anderson is a young Black male who has been in the architectural business for over almost 30 years. And he's worked on LAX projects, he's worked with different cities. He and I are working on a $30 billion request, $30 billion request to the federal government to provide subsidy down payments for for sale 2 to 4 unit housing that we're going to be creating a master plan for along the transit corridors. You'll hear more about this, but again, it's 2 to 4 units. And why? Because you can live in one and rent one and have cash flow. 2 families could buy a 4 unit apartment building unit and live in 2 and rent 2 and still have cash flow coming in. And again, this is land that's located along the 18 transit stations that are, the majority of them are already built. They're located along these transit stations. So, you know, we're eliminating cars, we're looking to support gentrification to the point that the communities stay Black and brown. So you'll be hearing more about this, but Michael Anderson, August the 10th, I'll put it in the chat box, and Dr. Melvin Gravely. These are 2 exceptional young Black men that you need to follow. You need to check them out on LinkedIn, and you need to support these books that are coming out because the education that they will provide to you is tremendous. I'm so excited about this. I love real estate, and I love people who understand the fact that there are these disparities that happen amongst us. It's not just because because of, yes, it is racism, but a lot of it is a lack of education on our part. How do we advocate for ourselves? And so that's why we have the community briefing, so that we have a safe place to have these conversations, find these resources, and educate ourselves so that we can empower ourselves for next generation legacy. So again, I want to thank you guys for being here. We want to thank all of our regulars who are here every week supporting the community briefing, and we're always looking for speakers. So if you'd like to be on the community briefing, again, put your information in the chat box and we'll follow up with you and we'll get our program started.
Thank you, Robin. Appreciate that. Text me the book so I can get those. All righty, Dr. Mays, welcome. Hope you have an update for us today because we need it. And so with that, Greg, it's back on you, and Stephen, you're doing your end of you're coming in at the end. Yes, okay. All righty. So welcome everyone, and Greg is back on to you.
Okay, so it is now showtime. And it's my pleasure to introduce our guests. Dr. Glenna Tolbert. Is it Tolbert or Tolbert?
As far as I know, check 1, 2, 3. Can you all hear me?
Yes.
Okay. As far as I know, it's Tolbert.
Okay. All right. Some pronounce the T and some do not. So we'll say Tolbert. Dr. Tolbert is a double board certified physician who specializes in physical medicine, rehabilitation, and spinal cord injury medicine for the past 25 plus years. She teaches and publishes her approaches to regenerative medicine as an assistant clinical professor of medicine at UCLA David Geffen School of Medicine. She is certified by the state of California and a qualified medical examiner for workers injured on the job. She's a graduate of UCLA, that's University of California, Los Angeles. She completed her medical school at Howard University Medical School, go Bruins, all right. Her interests are carpal tunnel syndrome, neck pain, back pain, sports injuries, industrial and work injuries, herniated disc, pinched nerves, arthritis, stroke, brain injury, and concussions. So she has received awards from UCLA. And as a young girl, she was diagnosed with an affliction that people told her that she was not going to be able to do a lot of things, have kids, have an active lifestyle. And now look at her, she's got a family and she dances ballet and she lives with no pain. So now, rather than my normal introduction, we'll go with this.
What's up, Doc?
Please welcome Glenna Tolbert.
Oh, thank you so much. And everyone can hear me, correct?
Mhm.
Okay, wonderful. Well, first of all, glory be to God that we are all here. We are alive, we are breathing. So I am just so grateful. Grateful that you all have invited me. And who knew? This is wonderful. Community briefings. Just thank you so much. Thank you to Crystal Mitchell and Greg Sneed and Steve Turner for inviting me. And thank you, Martin. I see that you've joined us. And thanks to my husband for being on the line as well. So I'm extremely excited. Thank you. What I want to do in our short time together is I want to introduce the concept that our bodies are made to heal. Our bodies are made to heal. Then next, I'm going to share with you some tools that we use in my practice and at the center to help get people to heal or simply just age fabulously. And then I'm going to share 2 to 3 stories. And then at the end, we can save questions. If we have time for questions, I'll take those at the end. How does that sound?
Excellent.
Good. Okay. Thank you. I like positive reinforcement. Thanks. So, did you know that you can find healing for your chronic pain without surgery or pain medications or physical therapy? And I know that sounds, that's provocative because we're used to hearing about surgery and pain medications and physical therapy, chiropractor even, and don't get me wrong, those are definitely options. But I'm going to share some secrets with you today that will revolutionize the way you think about long-term pain relief. And so again, my name is Glenna Tolbert, and I am a dual board certified doctor and a medical director of the Tolbert Center. We have offices in Beverly Hills, LA area, and Encino. And over the years, I've helped hundreds of patients, countless patients actually, heal from painful physical conditions without surgery. And if you ask me, what is the best way to get down to the root cause of your pain? My answer would be simply regenerative medicine. And so what is regenerative medicine? Regenerate, I looked up regenerate just in the dictionary, and it's to rekindle, to revive, to refresh, renew, regrow. And so in a nutshell, when I say regenerative medicine, it's using minimally invasive procedures along with the patient's own body to heal that person. And regenerative medicine therapies such as stem cell, PRP, and prolotherapy, which we're going to talk more about, are safe, cutting-edge alternatives to surgery. And studies show that people respond to regenerative medicine, and they actually have a better chance of maintaining a higher quality of life, which is what most of our patients are hoping for. So during this webinar, I'd like to share with you 3 secrets I've discovered about regenerative medicine and how you can use these treatments to get back to living the active life you know you deserve, the active life you imagine for yourself. And so I know you're probably thinking, how can you heal yourself from a painful physical condition without using traditional medicine, especially if it's not recommended by your traditional hospital or covered by your insurance company? I get it. Okay, I understand. But that's why I'm going to show you a great way you can enjoy long-term pain relief and get amazing results. So here we go. The first secret, which might not be a secret for some of y'all. Our healthcare system is largely controlled by big pharma and the traditional insurance model, which means, believe it or not, healing solutions are not regularly shared with the public. And because pharmaceutical and insurance companies have so much influence over our healthcare system, medicine has been lulled into submission. And this is important to understand because for most traditional hospitals, practicing medicine has become more about checking off the boxes on the computer and shuffling authorization forms than about providing unique, out the box, individualized, innovative, quality healthcare. So when traditional approaches to medicine fail, it's no surprise that many people feel like, oh, well, you know, the pain they're enduring might never go away. Next secret, patient education is king. And the main thing to understand here is that many patients may think they are not able to get healed from their chronic pain. But oftentimes that's because most doctors in the traditional healthcare system, they don't know about surgical alternatives. Therefore, you know, they're not up on them, which means they won't offer. They won't even mention it as an alternative. And if you mention it, they might kind of shun it or poo-poo it. And believe it or not, sometimes doctors are penalized by the healthcare plan if they offer these solutions that are not covered. So the truth is that once we have educated you, because education is king, about the many different opportunities you can overcome in order to overcome your chronic pain, you will become the expert of your own body. What a concept, right?
Mhm.
You as the expert of your body. Hallelujah.
Hallelujah.
Yes, thank you. I've got an amen choir. Yes, thank you. And this is one of the most important things when it comes to enjoying long-term pain relief and restoring an active lifestyle. As doctors, we are your GPS, and we are here to partner with you in your healing process. But I want you to know that healing is in your hands. Healing is in your hands. It should not be relinquished to doctor insurance company. It should not be relinquished to your health plan. You know, health is wealth, and you're going to relinquish this. So I want you to know that healing is in your hands. We just have to give you the right tools as your health team. Third secret. There are a number of healing possibilities for chronic pain and healthy aging. The big idea here is that big pharma and their traditional insurance model want you to think you can't have long-term pain relief or avoid surgery or pain medications, but that's just not simply true. The reality is that the healing possibilities are endless. And the reason I know this is because our bodies are made to heal. The example I love to share with my patients is, think about this. If you've ever, maybe cut yourself in a significant cut, and you have an open wound, you don't walk around with that open wound for the rest of your life. No. What you notice is your skin, and you take it for granted probably, it automatically heals. The wound automatically closes. And that's because our platelets, which are a type of blood cell, they signal new skin cells to the area, new fat tissue, new collagen, whatever is needed to heal you. And once platelets are in that injured area, they break down and release something called growth factors that grow your tissues. And these cells repair. They repair and trigger your body's own healing. And this is also known as our immune system. And that's just one of the ways regenerative medicine can treat chronic pain without having to rely on surgery or pain medications, which often come with undesired and unwanted side effects. So let me take a moment to share with you a couple stories, success stories we've had at the Tolbert Center. First person is Mark. And I first met Mark in 2013. He was 44 at the time. And he was referred to me by his primary care doctor after just struggling with years of chronic low back pain. Due to an old sports injury, I later found out he had played professional football. He had tried physical therapy, acupuncture, yoga, traction, chiropractic, Vicodin, which is a strong pain medication, and epidural steroid injections without relief. He gained weight, because he couldn't exercise any longer. And so I introduced to him the concept of regenerative medicine. And so I told him about something called prolotherapy. And prolotherapy is an injection, and prolo is short for to proliferate, to regrow. And I explained to him that, okay, after I interviewed him and examined him, and I identified where I thought the painful structure was coming from, okay, I'm going to trick the body and injure this area and trick it. So just like a cut finger, your body will race to try to heal it. So at this point, he said, okay, because he had tried everything. He underwent a series of 3 of these prolotherapy injections, which is regenerative medicine. And that was in 2013. And I didn't see him for another year in 2014, a year later. And he said, Doc, I've been doing great. I'm on no pain medications. Look, I've lost weight. We put him on the scale. He said, I've been hiking. I've been back to exercise. But he said, I started to feel a little something, and I didn't want there to be any issues. I didn't want any drama. So I'm back. So I gave him another injection, this time not the series of 3, but 1. I didn't see him for 2 years. He said, with the 2 years, he said, I've been doing great, but I feel it again, a little something. I said, look, Mark, I'm about a 30-mile commute for you. You have to take off work. You're a new dad. I want to tell you about another type of regenerative injection called PRP, platelet-rich plasma. And Kobe popularized this, Kobe Bryant, rest in peace. I said, it's a little stronger treatment. Right here in the office, I draw your blood. There's no downtime from work, no downtime. I take your platelets, those cells we need from the blood, and I inject it right back into your injured area of your back. He said, okay. So we did 1 treatment. I didn't see him again for another 18 months. And he said, Doc, I'm back. I don't have any pain. I haven't had pain. He said, but I'm back because you said that I would need 3 of these injections. And I put that money aside in my flex account at work, and I don't want to lose that money. So I gave him another injection, and I haven't seen him since. I last spoke to him in May of last year, and he was doing well. The next person I wanted to introduce you to is Margie. And I met Margie in 2014. And at that time, she was 64, very active 64-year-old lady, a dog trainer, gardening. Actually, unfortunately, when I met her, she was taking care of her disabled husband. And so she had a lot of elbow pain from that. And she came to me for elbow pain, right over the elbow, on the outside of the elbow. And she needed to be out of pain because she had her disabled husband she was caring for. So I diagnosed it as a chronic tendon injury. And I did 3 PRP treatments on her. That was in 2014. I didn't see her again until 2020. And this time she came not for elbow pain. She said, oh, that was a distant memory. She came for shoulder pain. I actually, because we do a whole person approach in my office, I asked her to see my therapist for a while first. And she did that for a couple months, but the pain was still severe. So she went ahead, and because she was familiar with PRP, we did it for her shoulder. Her last treatment was in December of 2020, and last spoke to her in May of this year, and she's doing great. Her dog training, gardening, and so forth. The last person I wanted to, or story that I'd like to share with you is a personal one. So I try not to get emotional, but it's my story. And excuse my me up there. But my story is, as Greg mentioned, is I grew up with chronic pain as a little girl and until being a young woman. And my mother, who also comes to my center, one day when she was working out said, oh, Glenna, do you remember how irritable you used to be as a child? And I said, yeah, Mom, I was in pain. And my husband can attest to that, who's on the line, because I was in a lot of pain. And so I was diagnosed with something called scoliosis at UCLA at the Student Health Center, which is a curvature of the spine. And during my my medical school training, I saw a lot of specialists, and the bottom line was just learn to live with it. And by the way, don't have any children, you know, because it could just make the curve worse. So it's my story, like many of us in life, right? Our stories, our challenges, our frustrations, our sadness, those are what become our passion. And that's my passion that I use to help others to be their best. And so during my training, I discovered or was introduced to kinesiotherapist. And kinesio is means movement. And so I was taught how to use, even though I was an athlete, I was using the wrong exercises for my back. And so I was taught how to move my body to help me heal. And so we have 3 of those kinesiotherapists as well in my practice. And we use exercise as medicine for healing the body. When I opened my first office in 2004, for some reason, I just developed this disabling fatigue. I mean, fatigue, tired. And I don't mean fatigue like, you know, cheers, have a little coffee, it'll all be good. No, I can remember sitting in my office, and when staff would say, doctor, your next patient's ready, I was pondering, oh my God, how am I going to make it through? It was disabling. I sought help from one of my UCLA colleagues. And fortunately, he ran the traditional testing, which is great to make sure there was nothing serious, cancer and so forth. And I passed that, but fortunately, he had an open mind to wanting to really help me and introduce me to the world of nutrition and nutritional testing and hormones and the importance of that for our healing. And I incorporated that into my practice. And that's how I got out of my funk of that fatigue. I've always been very athletic and was told that I would have some early arthritis. And maybe it was 5 or 7 years ago. That picture, if any of you are able to see the slides, is me injecting my knee. It's on our website as well. I gave myself prolotherapy injection for early arthritis under my kneecap. And then years later, I did my other knee. And I'm on no pain medications. I hike. I still dance ballet. And by the way, I have 3 adult, beautiful sons. So I did go on to have children. So to God be the praise. So that's my passion. That's my story. So some of you are probably thinking, I've tried everything and it didn't work for me. Well, I'm here to let you know some good news, and that is living with pain does not have to mean suffering. And when we as doctors are able to listen to people and figure out the root cause, I'd say to people, sometimes it's not about the what, it's about the why of a painful physical condition. Only then are we able to find the best treatment. You have to match the best treatment with the why for whatever is causing them pain. And so I've developed this program that I'm excited to share with you today. You can use this program to start enjoying long-term pain relief, have hope and healing, and even tame that aging process. We can do it with grace. The techniques used in this program are based on decades of research and treating patients with all types of musculoskeletal conditions. It's like getting a bird's eye view of your current health status and then zooming in all the way and looking at the cells in your body and asking them, why are you causing this person so much grief? With that information in hand, we are able to assess the root cause of your pain so that we can put together a comprehensive, holistic care plan to meet your health goals. I recently did a panel, looking at a patient's cells, their nutrition, toxins, their energy level. And I was looking at it, and she had joint pain, everybody, all over her body, joints just aching. And I was reviewing it with a consultant, and he made the comment, it looks like a wrecking ball is going through her cells. Her cells look so old. And I looked at her chart and I saw something as simple. I hit myself on the head like, oh my goodness, she's a smoker. Something as simple that I'd forgotten about until looking at her cells. So what this is going to do is help you be all that God intended, which is fabulous, regardless of insurance company, what the insurance company says, regardless of your age. And as a dual board certified physician and medical director of the Tolbert Center, who has been blessed to help countless patients heal from painful conditions without surgery, I've perfected a model that says, whenever you walk in our doors at the center, you are the center, whether you are a patient or you are a team member. I also challenge my team to be bold. When they have an idea, bring it to me. If you think it can help, it can save a patient's life, bring it on. And I challenge them, it's okay to be scared because maybe it's different. When others in the healthcare industry shun us for our non-traditional approaches to medicine because they know that maybe this non-traditional treatment can actually help someone, it's worth the risk. It's worth the risk.
Dr.
And
Glenda,
most of all, I encourage the team to take those bold steps, not just for the sake of being different, but for the love of medicine.
Dr. Glenda, we have some questions that are in the chat box that we want to get to before we, because this is
time. I told you to reel me in. I warned you that, didn't I?
I'm doing a little bit of that.
Okay. Okay.
And so one of the questions is, and I'm looking at them backwards, I guess. What about opioid addiction and that results from pain relief? Please share with us on stem cell injections and what about opioid addiction and that results from pain relief.
So that's somewhat of a vague question, but so I alluded to that a little bit when we talked about Mark, because I said Mark came to me and Vicodin is an opioid.
Mm-hmm.
And so also on our website, on our blog, we have a paper that I did publish looking at several patients that we were able to get off of opioids. I think it was maybe over the year and how we did it. And that's on our website. And how we did it was using all these different techniques. And in particular, in Mark's situation, as you see, it was the PRP that got him, out of pain. For Margie, even though she wasn't on opioids, but that's what happens. I take care of a lot of patients with opioids. And what I have seen is that people, and I spoke about this years ago on CNN when I was asked to comment on Prince's death. And what I've seen in my practice is many times people are placed on opioids because they have real pain. It's real.
Mm-hmm.
And what I've seen though is the root cause of the pain sometimes is not found. But if we have the opportunity to really identify that root cause, like with Mark, he's a success story. Now, is everyone able to necessarily get off? No. Can you manage people's pain though, where they're not suffering and maybe where they don't require as many opioids and they're able to get back to exercising and they have a life and they feel dignified? Yes.
Greg had a really basic question. Exactly what is pain and how much of it is physical versus mental?
So that was like, that was on my last two slides. I was going to talk about that. Those are the last two parts of the talk. And so what I was going to say is we use, and that's the executive program that I was referring to, we use a holistic approach. And pain is, you're right, there's the physical aspect, but we all process pain differently. And so when patients have come to me and say, doctor, they're saying it's all in my head, I'm saying, well, part of it is in your head because how we all process pain is different, right? Mm-hmm. And so at the center, not only do we want to figure out maybe what is the root cause, and then look at your immune system, look at you nutritionally, optimize your hormones, but we also have a mind-body component where we teach mind-body techniques to empower people, to give them their power back over this pain, because you can be in pain, but that doesn't mean you have to suffer.
Right.
So the answer, Greg, is both. It's all that.
So I think we, excuse me for cutting you off. I think we have a patient for you. Manita Williams is on here regularly. She says she had damaged nerves in her. Can damaged nerves be regenerated? She had back surgery in 2015 and she's still in chronic pain. So I think the timing is perfect for you to come on. She's one of our regulars who's here every week. So I think that you certainly have some response for her.
Yes. Well, I thank you for the opportunity and I thank you for the questions. My contact information is in the chat, and blessings upon all you all are doing and all of our businesses.
You are amazing, and you're the perfect kind of presenter for the audience that we have, because a lot of times we don't get to have these kinds of conversations with medical professionals. And as we segue into our Dr. Vicki Mays is our we've deemed her our medical correspondent. And so she comes on every now and then to give us some updates about the vaccine. But
Oh,
Dr.
wonderful.
Tolbert, we want to thank you for the blessing that you provided us today. We want you to come back. And especially as you start to interact with some of our regular audience attendees who may come and see you. Thank you
Thank
again.
you so much.
I
Well,
second
so
that.
much.
And Dr. Tolbert, I have a sciatic issue, so I am definitely gonna call you. I mean, I'm in agony right now.
Oh, I'm sorry. I'm so sorry.
So I will be calling you, but thank you so much for sharing. That was awesome. And as Robin said, we don't normally get those conversations and those questions answered when we go to the doctor, especially as Black people. Because we feel, I guess the medical profession thinks we have an unorbited tolerance to pain. And
That's a whole nother lecture that I love to give.
Yeah, I would love for you to give that as well. So thank you so much. And so
take care,
I
everyone.
turn it back over to Robin. I'm going to check out just for a minute, and I'm going to leave the hosting to Stephen. And Dr. Mays, thank you so much, but I got to get back to the kids and make sure that they're ready for competition tomorrow. So thank you all. So great. Stephen, where are you, Stephen? Oh, right here. Okay.
And please know that Dr. Tolbert's information is in the chat box. Please follow up with her. We'd like for her to come back, because again, I think that, as she said, there's so much enlightenment that she can provide to us. And then we will segue right on over to our medical correspondent, Dr. Vicki Mays. So glad to see you today. And I know you got words of wisdom for us.
Good morning, family, is where we start, and to, wish everyone to stay well. So that's why we need to be talking about some of these topics. What I want to do today is share a concern, share a study, and then share advice. So the concern is, if people have been reading the LA Times, one of the things that they know is, first there was an article saying that our numbers of COVID infections went up. Then the next article that they shared was the number of hospitalizations among Blacks in LA County is going up. And as I said to the county, please don't anybody act surprised when the next article are about the deaths. And so we need to do something sooner rather than later. One of the studies that recently came out in England was they looked at Blacks that had sickle cell. And one of the things that they were able to see is that you are more vulnerable to COVID-19 if you have sickle cell. That should not be surprising. But again, it's the kind of things that exist in our population that are not being talked about. So that's one of the things we need to make clear. If we know people who either have the sickle cell disease, and the study was also about the sickle cell trait. So should you get COVID infected, what they showed is that there was a greater likelihood if you had sickle cell that you were going to end up being hospitalized. And that was also both with the disease as well as the trait. So we need to have conversations in our population about, if you have sickle cell, you need to have a serious conversation about getting vaccinated. The other thing that people have been asking lots of questions about is the data that's come out recently about boosters and people who are immunocompromised. Because many of us, I see you raising your hand, many of us have different ailments in which we end up either because of the ailment or because of the medication that we take, we end up being immunocompromised. And what that data is starting to show is that potentially, while the vaccines are very effective, it may be that the extent of the effectiveness is a little less in people who are immunocompromised. So for this group, I sorely suggest that you keep watching about when people talk about boosters, that you ask all the time and that you push so that as soon as, you heard the drug companies, Pfizer, say they wanted to come out with the boosters, but, that was like, well, wait a minute, are you just, going to make another 2 billion this year? Or what is the rationale for that? So I always say, well, America in general might not need boosters. We may be a population in which we want to pay attention, we want to advocate, and we want to request that kind of information continue to be developed. So, you can push science by being very clear about things that you think should be done. And this is when, NIH is listening. The other thing I'm suggesting that we start thinking about getting our religious coalitions and others to really deal with the fact that the vaccines that we currently have are still considered emergency use authorization. And it's like we need to move to them because we don't have, particularly for Pfizer and Moderna, we don't have any results that are in question. And it's interesting because part of what people are really concerned about is things that were done at warp speed. Well, there's some things that warp speed would be good for, and that is making a decision.
Right.
Let it be warp speed. And don't get concerned that somebody skipped a step, because sitting across the table and looking at some data and making a decision, believe me, many of us have done that in a shorter rather than a longer amount of time. So there are things to keep bringing up, there are things to push, but I think it's very important that what we do, and I'm saying the we as researchers, as Black professionals, is answer your questions and the questions that are specific to our community. And that's part of what I am really pushing. I will have to give a shout out to LA City. I will have to give a shout out to the mayor's office, because when I shouted real loud about, I didn't think we were moving, the things that they're attempting to do. And I said, people do not need information, we need education. Right. So putting out a little, sentence about something, that's not where it is. And I want to shout out to, Dr. Tracy Veal. We call her the vaccine warrior, because she's going to churches and every place else to answer questions. So part of what, you all are just wonderful in doing is getting a message out for people to ask those questions. Some of those questions, if we can't answer, it gives us a reason to go and get them answered for you. So that's my shout out for today.
Dr. May, I have a question. One, I do have non-Hodgkin's lymphoma, so I'm going to pay attention to this whole idea of maybe needing a booster somewhere along the line. I am on Alcopa, and I've been taking that treatment three times a month, 1 week off, 3 weeks on. But there's Roger Dangerman put in his text box, and I want you to address this. There's been a report that 42,000 people have died from the vaccination. Well, over 500,000, well, 600 and some thousand people have died from COVID. So if only 42,000 people have died from the vaccination, what I've been reading is that a lot of times it's their underlying conditions that's been one of the challenges. So can you address that?
Sure, I can. I would have to see this because that is not the knowledge that I have. Mm-hmm. There has been a lot of tracking around the misinformation that is getting on the internet. As we say, there are very few people that have died from the vaccination itself. Yeah. And so that number is way beyond anything I have heard at many levels. And again, what I'm going to say about some of the stuff that we find places, there are even places that look like they're a journal, just so you know, and it'll have some kind of name and they're busy trying to sell themselves, by hits, just like other people do on the internet, and they're not official journals. So one of the things that I would say is, I can tell you with great certainty, we have saved more lives having developed a vaccination than we can't even now lose that many lives, given how many we have actually saved. And a lot of those are some of us. some of us who have been vaccinated. People have to realize that, as healthcare providers, we are right there. And it's like, some people have been sick and they have moved on and gone on, but those who have been vaccinated are here and tending to, try and keep others alive. So
let me just tell you who's in your amen corner. Greg Sneed is crazy. He says they're looking at the Facebook School of Medicine and talking to Dr. Feelgood, okay? And again, I really, really, really believe that that's why we appreciate you coming on here to dispel some of this stuff, because for some strange reason, we have turned into, we're going to go onto social media to find out what we want to know. That's the worst place in the world to go, right? And so this is why we have the community briefing. This is the reason why we love for you when you come on here. This is why we invited Dr. Tolbert on. We want to provide direct information, direct resources, and thank you so much for dispelling some of this stuff that's out there.
I'm going to hope, and Greg, now I have to steal that, about the Facebook School of Medicine. I just got to steal that. That was just too good. So I'm going to give you credit, though. But
and then, wait, one more. Then he got Nurse Instagram.
Greg, it's just like, your creativity just warms my heart. I love that because people are going to hear it out of my mouth, but I'm going to give you credit. One of the things I think is very important is that there's not enough venues, and this is the door that I've been beating on. For example, like a lot of our programs need to have this information because people are looking at, all these sites that Greg just talked about as a way to get information because they don't have a usual provider. They have problems with, what they perceive to be Western medicine. But I'm going to tell you, there is so much that is misinformation. My group is doing a study where we have these wonderful computer scientists who are scraping the web, finding out what the questions are that Black people are asking so that we can actually put together a educational slide set that we will just give away. But also what we're looking at is what the myths are about chips in our phone, chips in our head, the magnetized, that occurs in terms of getting the shot. And it's like, if we could put that creativity into really responding, it's like Black people would be living more than anybody else. Yeah. Because, we have come up with some things on social media that we have given great credence to, going back to the time of Jesus walking on the earth too. Right. And it's like, even Jesus would tell you, please don't put that on me. Right. So I just have, so we're trying to find those myths on the media and help to do something about it. So that's why I appreciate family here so much. Yeah. Because all you want to do is keep us alive, and I'm with you on that.
Now, we have Michael Browning has added to the chat box, Black women rally for action. The Los Angeles County wants to know what LA County Blacks feel about mandatory COVID vaccinations in the workplace. You cannot work unless you get a COVID-19 vaccine. Please answer the following questions so that our voices are heard. So he's added that to the chat box. There is a 20-second poll that you can click on, and we're asking everyone who can to at least participate in the polling to have your voice heard. So again, it's just our delight that we have you and that you don't mind coming on and helping us to spread the word and to provide the right kind of information that's available. And then finally, I've added in the chat box, Colette, who is our small business correspondent, has been away because her daughter got married. And so she's provided us with some new updates about grants and some other funding of information for small businesses. And then finally, I'm going to just turn everything over to Steve so he can wrap us up and tell us who we have coming up next week.
But Dr. May, before we let you go, can you briefly tell us a little bit more about the new variant of viruses out there and how did it come about? Based on your research.
Sure, and I'll do it quickly. what happens in variants is that viruses are very smart and they want to live too. So they're working very hard to live. So what happens is that as people start to get vaccinated and there's immunity, they start to change, they mutate. And what they do is each time they mutate, they actually try and mutate in a way in which their survival is higher. So Delta has been one of the, there's others, there's Delta, there's Lambda, there's some others, but we're focused on Delta because we have so much of it in the US. So Delta is able to survive because people are not vaccinated. So we don't have, people who have some protection so that that virus, when it even comes and tries to tap somebody who's not vaccinated, but they live in a household where they got a little bit of immunity, then that virus says, uh-oh, can't knock on this door, can't live here. So they keep going and then they host themselves as a mutation. And this mutation makes you sicker. It is more deadly in terms of the amount of time that, it destroys, different things in the body. So that's what's going on with Delta. You should really want to be vaccinated. And the reason to think about that is it's not just about you. It's also about our kids. I didn't even do the kid thing today, but, because I think that's another day to talk about decisions parents have to make about their kids in school, particularly those that are under 12 who cannot be vaccinated currently, and what are best ways to protect them are.
Thank you so much. And again, my name is Stephen Turner. I'm the managing principal of the Slate Group. We're a risk management insurance firm specializing in workers' comp, general liability, and group insurance. And I've been fortunate to be affiliated with Tolbert Medical Center for the past years in capacity, as well as part of the Black Business Association. For all those on the line, please join us next week when our special guest is Mike Miller, who is the president and founder of Bold Communications, a nonprofit, Black-owned affordable housing developer. Mike Miller was a star wide receiver with Stanford, but I knew him when he was a young man who has made the transition to providing housing for those who are in our underserved community. And they talk about the challenges as well as opportunities for Black contractors and developers providing housing and addressing our homeless situation. On behalf of all, we'd like to thank you. Before I leave, Emma Maxey, do you have any updates from the SBA?
Thank you. Hi, everyone. Sorry, I've been on 2 meetings. And thank you, Dr. Mays and Dr. Tolbert, for all your information on the health issue. We really need to hear everything you said. That was the most important thing. But real quick, if anyone applied for the Navigating Pilot Program, tomorrow's the last day. They extended the deadline until midnight on July 30th. So you still have time to get your application in. And one thing I want to say about the EIDL, those that are waiting, and I know a lot are, and you haven't heard back from the SBA, be patient. They are going to try to address all the pending applications around the first week or second week of August. No, I don't want to give you exact time, but all the pending applications they should address. This does not include any new applicants that are coming in, just the ones that are pending. And I know people are really desperate to get feedback or their money. So I know how important it is. So that's all I can say for right now. And thank you, guys.
Again, thank you for joining the community briefing. We'll see you next week.
Thank you.
Thank you.